Troubleshooting. Use the following troubleshooting procedure if either the patient cannot start diaphragm pacing or had previously paced effectively and is experiencing a loss of or significant reduction in tidal volume. Check the battery icons on the display to determine if battery replacement is required. Check if both sides are on. Check if the right and left three-wave icons on the display are on during inspiratory periods. If the display alarm icon, sound, and LED alarms are active, a problem has occurred. The batteries may be low or the antennas may be defective. Replace the antenna with a new antenna. If the alarm condition disappears, the antenna was defective. Discard the defective antenna. If the batteries and antennas check out as fully functional and there are no alarms but pacing is not possible, see if effective pacing can be restored at a slightly increased amplitude setting. The patient may be experiencing a temporary increase in pacing threshold, thereby making the current spirit amplitude settings ineffective or too weak to pace. Effective pacing can be restored in a patient experiencing a temporary increase in threshold. However, a further increase in tidal volume will not be possible if the patient is experiencing diaphragm fatigue. If the patient had been pacing effectively prior to the loss of or significant reduction in tidal volume, place the patient on mechanical ventilation for 72 hours before restarting the pacing program. Call your physician and Avery Biomedical Devices customer service if large amplitude adjustments fail to restore effective diaphragm pacing. Check for infection often indicated by fever, pain, redness, or swelling anywhere in the body. Experience has shown that diaphragm pacing may become ineffective when the patient has any type of infection in any location. Infections may not always be evidenced by fever, but an abnormal white blood cell count may be noted. Treat any infection immediately. Pacing at slightly increased amplitude settings may be effective during treatment for infection. Otherwise, the patient may require mechanical ventilation. Be sure that the patient has not suffered any injury or accident that may have caused mechanical damage to implanted system components. If none of these circumstances apply, contact Avery Biomedical Devices customer service. Feel free to visit www.averybiomedical.com for more information or contact us at any time at our facility in Commack, New York. Thank you for your interest in the Avery Diaphragm Pacing System.